Alrighty, so this is my reflection video on the patient health history video that I had recorded with one of my patients earlier in the semester. As I look back and rewatch the video, I was able to see some things that I did well on and then other areas where I could have really improved on. Overall, I noticed that just throughout the semester, I've improved reviewing health history on my patients just with more practice. I think in this video, since it was recorded earlier in the semester, that I definitely saw that I was a little more timid and definitely needed to improve on some of my body language skills. For instance, I think I talked loud enough and made good eye contact. I just wish I would have positioned myself to where I could have faced my patient more. I noticed I was looking at the computer a lot and then having to turn back and forth, where it probably would have been better just to originally face my patient and have the computer where I can see it as well. I think that just would help to build that trust between my patient to where a better conversation could be done. As far as that, I think I also could have asked a little bit more in-depth questions. I think I did a great job in asking those open-ended questions that allow my patient to tell their story or to explain their reasoning, but I just wish I would have taken that one step farther or just ask one more question after just to get more information. For example, as I was asking about my patient's nutrition, I think I did a good job in asking the question where I state, tell me what a day in your life looks like as relating to the meals that you eat. And my patient was explaining like good proteins, veggies, blah, 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 but then I just left it at that. And I wish I would have asked, well, are there any sources of sugar, like any soft drinks, or do you have like any habits where, for instance, do you drink Starbucks every day or do you drink coffee? Because your patient can eat super healthy meals, breakfast, lunch, and dinner, but then they also could have maybe a habit where they drink an energy drink every day. And so I think just asking that one more question or a few more questions is super important, because nutrition plays a huge role in oral health, especially in the development of caries. And so as far as that, another strength that I wrote down was I think I did a great job in preparing myself before the appointment and being able to recognize something and educating my patient about it. So for example, as I was gathering information on my patient's drug sheet and the medications that they take, I saw a connection between one of my patient's medications that has a side effect for heartburn, and made that connection when my patient said they also have heartburn and they were taking a medication for heartburn. And so I was able to educate my patient about this and told him that maybe next time he's going to see the doctor or physician, maybe ask if there is a substitute medication where that doesn't cause heartburn, so they wouldn't have to stay on that heartburn medication. And who knows, maybe there is not another option. I think it was just important to educate my patient about it so they're aware of it, because I think a lot of patients don't understand or maybe forget about some of the side effects that their medications can cause. So I thought that was a good strength of mine, just having that education about having that knowledge and education about certain medications that my patient is taking. I guess another thing that I did well, that was, I guess, going along with the education role, I noticed how I kind of provided some feedback, but not really I did the educating role, but I didn't really provide any feedback or any recommendations of how to resolve any issues. And one thing where I noticed that was, as my patient was explaining to me about their jaw pain, I asked the questions like, when are you experiencing it? How long has it happened? How frequent? Which are great questions, but then I didn't really do anything to say, well, maybe you can try getting a night guard, because my patient explained that they clench their jaw at night. And so I wish I would have recommended like, oh, we can talk to maybe the dentist, or recommending a product like a bite guard or a night guard to wear at night to resolve that. And so I think I could have done better in that area. But overall, I think after watching this video, I definitely noticed I have plenty of room for improvement, and I intend to work on those aspects of asking more in-depth questions just to get a little more information from my patient, and then also working on that body language as well. I think just even from when I recorded that video to now, if I were to record it again, I think I definitely would, especially just showing confidence, I would be way better. But there's still room to improve, and I plan to work on it in future weeks with each DHT. I think being able to go back and watch myself, it was really beneficial in having me pick out my weaknesses, so I can really focus on them more as I continue to work with more patients and reviewing their health history in the future weeks. So